Hello and welcome to our presentation on rehabilitation program for stress urinary incontinence in women. To briefly introduce urinary incontinence, it is any condition that involves the loss of bladder control. There are 6 main types of urinary incontinence, namely true incontinence, urge incontinence, stress incontinence, mixed incontinence, overflow incontinence, and functional incontinence. Out of all types, stress urinary incontinence, also known as SUI, is most common. So SUI can be defined as the complaint of involuntary leakage of urine on effort or exertion, or on sneezing or coughing. Specific to SUI, it affects twice as many women compared to men. On a global scale, around 40 to 35% of adult women are affected. SUI is also the most common form of urinary incontinence for women, with 78% of incontinent women presenting symptoms of SUI. An overview of a decades of Hong Kong population surveys shows that SUI drastically increased over time. Not to mention, given the global prevalence range of SUI is set 4 to 35% for adult women, the prevalence in Hong Kong women is considered to be high amongst the world. To compare age and gender groups specifically in Hong Kong, it is evident that not only females with UI are consistently more prevalent than males across all age groups, but a clear trend is evident. The more advanced it is the age, the greater the difference in prevalence between female and male. The impact of SUI can be best holistically reviewed through the ICF model. Factors affecting the health condition primarily consist of SUI itself alongside pelvic floor dysfunction. This can be addressed to pelvic floor atrophy or overactivity, or even hip muscle weakness and limited flexibility. Limited activities which from SUI and related impairments commonly include coughing, sneezing, running, and other functional or transitional activities, therefore potentially hindering social activities, sexual intercourse, and more. Environmental factors play a role in affecting SUI through occupation, access to primary health resources, patient education, and information accessibility, not to mention family support. Additionally, personal factors may definitely impact a woman's experience with SUI, including stigmatization of seeking treatment, lack of self-management skills, poor stress coping mechanisms, and finally, low self-esteem and self-efficacy.
So there are actually 2 main functions of the pelvic floor muscles. The first one is to provide constriction to the urethra, vaginal canal, and anal canal. And this is mainly done by the puborectalis muscle, as well as the anal and urethral sphincters respectively. The second main function is to provide support or to floor the pelvic viscera. So this is mainly done by the pubococcygeus, iliococcygeus, and coccygeus. And so during contraction of the pelvic floor muscles, it goes from a basin shape due to gravity upward and lifts up into more of a dome shape. So if the muscles are able to function properly, the pelvic viscera and rectum will lift cranially. However, if they are weak, perineal descent will occur.
So moving on, I'll be talking about the causes of stress urinary incontinence, and there are 2 main reasons that causes this problem. The first main reason is the poor urethral support by the pelvic floor muscles, when there is an increase in intra-abdominal pressure, like during stress maneuvers. Force should be transmitted equally to the bladder and urethra from the intra-abdominal pressure to the intra-urethral pressure. However, weakened pelvic floor muscles will not provide sufficient force to clamp on the urethra, and there isn't enough intra-urethral pressure to close off the urethra, and this is when leakage occurs. The second main reason for stress urinary incontinence is intrinsic sphincter deficiency, ISD. This theory suggests that the external urethral sphincter is weakened and unable to generate enough urethral closing pressure, and leakage might occur during exertion or even in severe cases at rest. And here are the main reasons and main causes for ISD. 75% of patients who have ISD have previous pelvic surgery, like failed bladder suspension surgery, etc., and 15% of patients had nosocomial infections, leading to ISD eventually, whereas the remaining population who had ISD are due to other neurological conditions like myelodysplasia, etc.
And now we are going to talk about some risk factors of a stress urinary incontinence. And we have classified the risk factor into 2 aspects. One is sex-related and the other is which normal person will get. So and now we'd like to focus on the sex-related risk factors. The first one is the route of delivery. Since there's multiple kinds of delivery for female to give birth of their babies, so we're interested to see if the difference will cause the increase in the risk of the symptoms. So we found that the vaginal delivery has a higher chance of 2.3 times than a person without any babies, and for the cesarean section, which was also have a 1.5 times higher. And then for the parity, the mother of the two children will have a 8 times much higher chance than a female without any babies or without giving born to any babies with a high risk. And now we have come to the symptoms. And we will, the stress incontinence will cause urinary leakage when there is an intra-abdominal pressure increase during activities such as cough or sneezing. And besides, physiotherapy will also undergo some SE and OE. For SE, we are interested in the symptoms of urinary and the bowel, and also if there's any past medical history related to the pelvis and the bladder. And there's some OE, such as some questionnaire we can ask or some observation of the breathing pattern, so that we'll understand more about the problem with the stress incontinence.
So after understanding the symptoms of stress urinary incontinence, we'll talk about the treatments. So there are two main treatment approaches to treating stress urinary incontinence. So one is the conservative treatments and the other is surgical treatments. So conservative treatments include exercise therapies, medication, and lifestyle modifications. And in terms of surgical treatments, there are special treatments such as birch urethropexy, copal suspension, and different types of slings to substitute for pelvic floor muscles. But in this presentation, we'll mainly focus on conservative treatment. So pelvic floor exercises is a main part of conservative treatment. And as we know, when pelvic floor muscles contract, it puts pressure on the urethra. So loose pelvic floor muscles will lead to the inability to stop her urinary flow. So by strengthening pelvic floor muscles, we can improve the function of pelvic floor muscles in stopping urinary flow. So for each person, it could be prescribed to each patient very personally. So for patients with a grade 0, 1, or 2 on the modified Oxford scale, it would be better for them to use NMES, biofeedback, and vaginal cones to assist them in activating the pelvic floor muscles. And for patients at grade 3, 4, 5, it would be suitable for them to just conduct pelvic floor exercises to strengthen pelvic floor muscles. So pelvic floor muscles have been exercises have been proven to be effective by many clinical trials. So for example, for a systematic review of clinical trials focusing on 12-month outcomes for supervised pelvic floor muscles training, reported stress urinary incontinence cure rates of 58.8%, and also when combined with adjunct therapies, cure rates are raised to 73%. So there are very specific instructions when teaching pelvic floor exercises, but we will cover that in further detail in our video later. As for the FITT of pelvic floor exercises, we'll also cover in our video. So there are some adjunct therapies that can be used for pelvic floor exercises. So for example, like we mentioned before, for grade 0, 1, and 2 on the MOS, it would be good to use some vaginal cones or biofeedback to instruct patients on how to activate their pelvic floor muscles, or if they cannot activate it at all, it would be suitable to use electrical stimulation for these patients. On top of exercises, it would be suitable for patients to adopt different lifestyle modifications, such as weight loss, or learning voiding techniques to clear out their bladders, or learning anticipatory contraction of pelvic floor muscles before strenuous activities. So clenching their pelvic floor muscles right before coughing would prevent leakage. Also, they would be advised to drink
more frequently but less per drink, as opposed to drinking a lot at a time to prevent their bladder from filling up. Also, some medications to prevent stress urinary incontinence would be duloxetine or some estrogen therapy, and probably others such as darafenicin or fesoterodin to treat overactive bladders. So now we will move on to show our video.
It's a bit embarrassing, but ever since I gave birth, whenever I cough or sneeze, there's urine leaking out. I don't know where to seek help or what to do about it.
So actually, there's nothing to be embarrassed about. So urinary leakage is actually very common, especially for women who gave birth. So I think you've come to the right place. Physios are actually well trained to treat problems related to pelvic health issues. So I think we are there to help.
Before we dive into the exercises that you can do, it is good to go through some of the basic anatomy involved so that you can have a better understanding of what you will be training in your body. Here you can see a model of the female pelvis. There are 3 main organs involved that have 3 respective openings that go through the pelvic floor. First is the bladder that leads to the urethra where urine comes out. Second is the vaginal wall that leads to the vaginal opening. Third is the rectum, the end of the large intestine which leads to the anus. What supports and surrounds the organs and their respective openings is the pelvic floor, which is comprised of a thin sheet of muscle that stretches across the entire pelvis. Other smaller muscles include the anal and urethral sphincter, which constrict the anal and urethral opening respectively. Dysfunctions in the muscles mentioned could lead to issues such as anal, or in this case, urinary incontinence. Now we'll be first instructing you how to perform pelvic floor exercises, first in easier positions. For easier pelvic floor muscle activation, position your pelvis in a gravity-eliminated position. Being in crooked lying with pillows under the pelvis would be the easiest via increased gravity to assist the elevation of the pelvic floor. Position yourself on a plinth or mat facing the ceiling and with both knees bent. Tighten and draw in and up around the anus and urethra, pulling up the pelvic floor. Hold as long as possible whilst keeping breathing. You may place your hand at your mouth to feel for your own breath. You should not feel your abdominal, thighs, or muscles at the buttocks contracting. These muscles should be done daily. Depending on slow or fast twitch muscles, hold for 5 seconds for slow twitch muscle activation, slowly relax and rest for 10 to 20 seconds. For fast twitch activation, pull the pelvic floor up, hold for 1 second, then relax. Perform this exercise at a minimum of 30 to 45 repetitions a day. To progress the exercise, remove the pillow underneath your pelvis. Straightening both knees also adds a challenge. You may also contract at a longer time, such as 10 seconds, depending on your subjective feeling. When you can contract your pelvic floor muscles with ease, try training on a chair. Whilst training on a chair, position your urethra against the chair and contract your pelvic floor muscles. You should be able to feel as if your urethra has been lifted off from the chair slightly. This exercise can also be progressed into standing, or be performed on a football, both adding more challenge to the core and pelvic floor muscles. In addition to pelvic floor muscle strengthening, other exercises such as the clamshell exercise and the adduction exercise should be done as adjuncts to pelvic floor muscle training too. Adjunct devices such as the vaginal cone or beads can also be used to help pelvic floor muscle contraction. Do consult a physician or a therapist prior to usage of such devices.
Okay, so here are a few lifestyles and behavioral modifications to tackle your stress urinary incontinence problem. So firstly, maintaining your proper personal hygiene, like changing your clothes daily. Secondly, adequate fluid intake. Thirdly, avoid caffeine, alcohol, smoking, or any sedentary lifestyle. So try to maintain a healthy lifestyle. Proper weight management with regular exercise, and intake more dietary fibers to alleviate the constipation you have.